Hello and welcome. Today we're diving deep to a specific type of kidney stone called Indinavir stones. These stones, though less common than other varieties, present unique challenges in diagnosis and treatment. So, let's explore what makes them different, how they form, and what can be done about them. The primary cause of Indinavir stones is the use of the antiretroviral medication Indinavir, a protease inhibitor. This drug, previously widely used in the treatment of HIV, has a relatively low solubility in urine. When Indinavir is excreted by the kidneys, particularly in individuals who are not well hydrated, it can precipitate out of the urine and form crystals. Over time, these crystals can aggregate and develop into larger stones. The pathophysiology of Indinavir stone formation is relatively straightforward. Indinavir, once ingested, is processed by the liver and kidneys. Because of its poor solubility, if the concentration of Indinavir in the urine exceeds its solubility threshold, crystal formation begins. These crystals can then serve as a nadir, or starting point, for stone growth. Other factors like urine pH and the presence of other substances in the urine can also influence stone formation. The stones themselves can then cause obstruction within the urinary tract, leading to pain, inflammation, and potentially kidney damage. Epidemiologically, Indinavir stones are primarily seen in individuals undergoing antiretroviral therapy for HIV. The incidence was notably higher in the early years of Indinavir use, before optimized dosing strategies and increased patient awareness of hydration importance were implemented. With the advent of newer, more soluble antiretroviral medications, the occurrence of Indinavir stones has declined, but it remains a risk for individuals still taking the drug or who took it in the past. The signs and symptoms of Indinavir stones are very similar to those of other kidney stones. The most common symptom is severe, colicky pain in the flank or lower back, often radiating to the groin. This pain, known as renal colic, is caused by the stone obstructing the ureter, the tube that carries urine from the kidney to the bladder. Other symptoms can include nausea, vomiting blood in the urine and hematuria, and frequent or painful urination. If the stone causes a blockage and leads to a urinary tract infection, fever and chills may also be present. Diagnosing Indinavir stones involves a combination of imaging and urine analysis. A non-contrast CT scan is typically the gold standard for identifying kidney stones, including those made of Indinavir. Indinavir stones are often radiolucent, meaning they are not easily seen on plain X-rays. Urine analysis can help identify the presence of Indinavir crystals, as well as assess for infection or other abnormalities. A thorough medication history is crucial to identify Indinavir use as a potential cause. While kidney stones are often classified by their chemical composition, calcium oxalate, uric acid, etc., Indinavir stones specifically are classified simply as Indinavir stones due to their unique etiology. The classification is important because it directly influences the treatment approach, as some treatments that work well for other types of stones may be less effective for Indinavir stones. Treatment and management of Indinavir stones depend on the size and location of the stone, as well as the severity of the symptoms. For small stones, conservative management including pain medication, alpha blockers to relax the ureter and facilitate stone passage, and increased fluid intake may be sufficient. For larger stones, or those that cause significant obstruction or infection, more invasive procedures may be necessary. These can include extracorporeal shock wave lithotripsy (ESLL), which uses shock waves to break the stone into smaller pieces, ureteroscopy, where a small scope is passed through the urethra to visualize and remove the stone, or in rare cases, percutaneous nephrolithotomy, a surgical procedure to remove the stone, a small incision in the back. It's also critical to optimize the HV regimen, if possible, to minimize future stone formation. Prevention of Indinavir stones primarily revolves around adequate hydration. Individuals taking Indinavir should drink plenty of water throughout the day to keep their urine dilute. The goal is to produce at least 2 liters of urine per day. Your doctor may also recommend specific dietary modifications or medications to help prevent stone formation. Regular monitoring of urine pH and Indinavir levels can also be helpful. The prognosis for individuals with Indinavir stones is generally good, especially with prompt diagnosis and treatment. Recurrence is possible, particularly if underlying risk factors are not addressed. Recent research has focused on developing more soluble formulations of Indinavir and identifying genetic factors that may predispose individuals to stone formation. Newer imaging techniques are also being explored to improve the detection and characterization of kidney stones, including Indinavir stones. Thank you for watching.